Michael Moore's film Sicko opened to a mix of rave reviews and harsh criticism. Gallup looked at public opinion concerning healthcare in the country's Moore covers in the film. I'm Yasmin Vasugian, and this is the Gallup World Poll. Moore's film Sicko opened nationwide this past June. Moore is known for making controversial films in the past, like Fahrenheit 9/11 and Bowling for Columbine. But this time, he's up against a different animal, the healthcare system. In a recent appearance on Larry King Live, Moore went head-to-head with CNN's Sanjay Gupta to challenge Gupta's criticism of the film.
When he ran his report, anybody who TiVoed it can rerun it now, and you can see that they've covered up the CNN logos, have covered up Cuba as number 39. It's right there, and he's just not telling the truth.
Moore's portrayal of socialized healthcare in Cuba, France, and Canada were positive, whereas the U.S. healthcare system was seen as extremely flawed.
If you denied more people health care, you got a bonus?
When you don't spend money on somebody, it's a savings to the company.
In Cuba, Canada, and France, the Gallup World Poll revealed an overwhelming majority of the citizens are confident in the healthcare system, the lowest of which was in Canada, where 69% of citizens are confident in the system. When a slightly different question was asked of Americans, 69% of U.S. residents said they had at least some confidence in the medical system, and just under a third had little to no confidence in the system. Michael Moore frequently states that healthcare services in these countries are free, with the exception of the U.S., but others, including CNN's Sanjay Gupta, debate that medical care is not free, as it's paid for in the country's taxes.
The point is, though, and I think you'd have to concede this point, Michael, that you're trying to lead people to believe, again, people who are really concerned about this issue, that it is free in these other countries. And that is what I think
is free.
It's not, Michael. I mean, the taxes are high. I understand that you're equating taxes with HMO premiums. I get it. I've studied this stuff, as have you. But to just say to someone who doesn't have a sophisticated understanding of exactly how healthcare works that it's free is simply not true.
In Canada and France, the Gallup World Poll asked, have there been times in the past 12 months when you didn't have enough money to pay for medical or healthcare costs? In France, 12% of people said yes, and in Canada, that number was lower at 8%. In Cuba, the question was slightly different. Gallup asked if healthcare systems were accessible to anyone in the country, regardless of their economic situation, and 96% of Cubans said yes. If we switch gears and look at U.S. numbers, just under a third of Americans said there have been times in the past year where they haven't had enough money to pay for healthcare. I'm Yasmin Vasugian, and join us again to hear more voices from around the world.